Ministry of Public Health of Ukraine. Krok 1. Medicine. Year 2018. Number 092. The right leg of a 40-year-old woman measured at the shin level is by 2 centimeters smaller in the diameter than the left leg. Anklejerk, Achilles, and knee-jerk reflexes are absent on the right. What is the most likely mechanism of hyporeflexia development during peripheral paralysis? A. Disturbed synaptic impulse transmission. B. Activation of excitatory impulses from the CNS. C. Disturbed conduction of stimulation. D. Inhibition of pyramidal motoneuron. E. Disturbed perception of stimulation. Muscle atrophy, wasting or loss of muscle tissue, disuse atrophy, occurs from a lack of physical exercise, disuse of specific muscles. Neurogenic atrophy occurs when there's an injury to, or disease of a nerve, such as with multiple sclerosis, demyelination and destruction of nerve cells. Peripheral neuropathy is a disease affecting the peripheral nerves that may impair sensation, movement, gland or organ function depending on which nerves, motor, sensory, or autonomic nerves, are affected. Sensory symptoms commonly include loss of function, negative symptoms, including numbness, tremor, impairment of balance, and gait abnormality. Gain of function, positive symptoms include tingling, pain, itching, crawling, and pins and needles. Motor symptoms include loss of function, negative symptoms of weakness, tiredness, muscle atrophy, and gait abnormalities, and gain of function, positive symptoms of cramps, and muscle twitch, fasciculations. Knee-jerk reflex. Patella reflex is a reflex that causes the contraction of the quadriceps muscle when the patella tendon is stretched. Golgi tendon reflex is a normal component of the reflex arc of the peripheral nervous system. The tendon reflex operates as a feedback mechanism to control muscle tension by causing muscle relaxation before muscle force becomes so great that tendons might be torn. Anklejerk reflex, Achilles reflex, occurs when the Achilles tendon is tapped while the foot is dorsiflexed. It is a type of stretch reflex that tests the function of the gastrocnemius muscle and the nerve that supplies it. The positive result would be the jerking of the foot towards its plantar surface. This disease is not caused by the central nervous system but peripheral nervous system, because the disabled sites are local. This is not about synaptic problem but conduction problem, because it is not limited at the nerve endings but the body, the axon, gets the problem. The answer is C. Disturbed conduction of stimulation.